And also thanks Kala and IWA to give me this opportunity to speak at the plenary when I'm just going to retire from the Gates Foundation. This is my last public event representing Gates Foundation. But I will be with you, so I will be working with you by different mechanism, but of course by retiring mode. So, I was involved in this sector for quite long, so 35 years, more than 35 years, I think. And then when I see all this trend, global trend, we have a lot of global commitment happen in this last 45 years. And I can see a lot of change happen during that course of time. But still the thing that what we need to achieve, that's not really happening. But luckily the last 10 years was a critical moment for all of us because we really changed the sector substantially. I'm not really saying that I'm working in this field, but I can see the change, why it happened. It is all because of some small money that actually Gates Foundation contributed here as a catalytic fund, and none of the organizations did that put money in the past. And at the same time, it's not really money, it's all of you. Partners are the critical people, individual organizations who really make things happen. Today I'm going to talk what happened in this last 13 years after I joined the foundation. This is very interesting story. I only want to put this story in forum. It is the IWA, same event that happened in 20 years before, 2004, in the France. Dolai and myself, you can see Dolai how young he was, how young I am, and my other colleague Mingma Sisherpa should be here, which people are still here. So these are the people who really advocate for the non-sewer sanitation and fecal source management those days. Hard to make people believe that this is also we need to go. And I still remember that day when we submitted our paper in IWA on fecal source management, our paper was rejected. And then we came with the poster. We all army, seat army. July, me and our colleague went to there and we put the panel like a poster. And we put the poster. I have poster on fecal source management from Pokhara city. He has poster from the IWA, so many things from Africa. And we put the panel in the corner. And then we were sitting in the corner. Then a couple of the big guys came from the IWA to see the poster. And I said, Dolai, come, somebody come, you have to come in there. And then that time, this guy went like this, and they just crossed the panel. Even that guy didn't see our poster. That was the story those days. And Dolai and we were so frustrated that time. But now it's a change. I'll tell you what happened. After a couple of years, then I was wearing several hats. I worked in many places. And one of the last work before Gates Foundation was with the UN Habitat, UNDP. Then I was working for several years there. Then I really at that time I only have 25 years of experience on sanitation. Then I said, let me do something tangible things. Then I took the challenge that to work in Bangladesh. And I need to fix the sanitation system, sanitation problem in the slum communities in Bangladesh. Then I know that I had all those ideas how I can do. But when I worked there for 2 years, I couldn't do anything because there was no technology that can really help to solve this. The other problem was it's very difficult to convince the authority over there, especially I was working for UNDP and they don't have that mechanism. How can I put other components there? Toilet was the main thing, pit latrine was common. I need to increase number of pit latrine, I can do that. So I can really help there. And they said, no, I want to go out from here. So maybe I need to find some other place I can do some other things. Luckily, I was invited by Gates Foundation to work with them. From 2012, I joined there, and 2013, then I worked in the Gates Foundation. In the Gates Foundation, when I went there, my first task was how to really demonstrate fecal source management system in some of the city, little bit large scale one. That time, I don't know if Bangladesh colleagues are here. Yeah, colleagues are there. And Rajiv, I don't know where he is, Hasin. Rajiv also, Rajiv Munakarni, right? He was yesterday, I saw somewhere. And then what happened was, Rajiv, let's find some place where we can really demonstrate because of management. Big scale, not small project type. Then Rajiv and Hasin, we sit together. We know them already before when I went to Bangladesh. Then we found some city done. Okay, now let's do that. This city are mine. We can do a lot of work there. And we designed a large-scale fecal source management program which can address entire value chain. And that was the first time that Bangladesh has now entered into the fecal source management program. Although Bangladesh was already quite ahead on the demonstration or establishment of the ODF country. They are the first country in the South Asia who achieved ODF, but they don't have any fecal source management component there. But that is the project that really did several cities. We worked there, many other partners engaged there, and then we able to demonstrate some entire sanitation value chain program in a couple of cities. Now you can see how it evolved. From 2015 to 10 years, a lot of things happened there. Even I can't say what's going there. Like the Institutional Regulatory Framework that was created during that time. We have established big capacity building hub. I think great colleague are here who head that. And a lot of NGOs, especially WaterAid, SNB, Practical Action, all were working in that. And that time, I worked there for a couple of years. Then my colleague from the DPHE, the young colleague, I don't know if they are there or not, Cecil, I don't know, Cecil here or not, Cecil, there. So Cecil and Samista, they asked me, Dada, why you are not coming to work with the government? Why only you with the NGO? I said, okay, we'll come there. And we realized that because without working with the government is not possible to scale. Then our focus went to the working with the government closely. We established the citywide inclusive sanitation and efficient support cell. My colleague Muid was leading that program, and a lot of things happened inside the government. And their data system established, data system helped to convince government that no, we are not really done, because there are a lot of, although this is development good, I mean, open defecation was achieved, but the safety managed sanitation was not happening. They prepared a lot of flow diagram that really helped to understand, convince them, government, that we need to go a different way. And then we have a lot of, then once we did with the government, a lot of investment coming there, like ADB, ISDB, World Bank, AIB, all they started to invest there. You can see that they have more than $2 billion investment now rolling only in Bangladesh, and they are doing great. And then when you go to the India, I don't need to explain a lot in India because all colleagues from India are here, how they transform in 10 years. Just 10 years, 11 years back, 600 million population were doing open defecation. 10 years is almost zero. So how it happened? It cannot be done by NGO and INGOs and the NGO1 without engaging government. The way how Swachh Bharat Mission started in 2014, that time we were doing small work. At the same time, when it is announced, then Gates Foundation was clever enough to really work with the government, and we come with the Go Big India program on sanitation. Sakshi, myself, Madhu, we all run behind, I don't know how we run. Still Sakshi is running there. And the way how we engage with the government, the way how we support to the government, that really helped to transform. And one hand, government was engaging in the making toilet. Our job was how to introduce fecal source management. Right, Ashim? So all my young colleagues were engaged a lot there. And the way how it was happened, then the policy reforms, everything started with the integrating the fecal source management in the larger Swachh Bharat Mission program. And only one, that time when Swachh Bharat Mission program started, only one FSTP was there, only one. That was by my colleague, where is CDD? Hers. CDD was the one who actually established one FSTP in Devanagari. It was near to the Bangalore airport. That became the like pilgrim. Everybody go and see, learn from CDD, FSTP. And we invited so many people, even ADB professionals were there, city government officials, from not only from India, from the other countries as well. They saw the FSTP. Now they have more than 2,000 FSTPs in operation, And not only that, that's the learning ground for not only FSTP, entire FSM domain, they have really demonstrated. That is that we call like the impact at scale by showing something good. And it was not only national level event. And then other good thing happened was India is like a continent. There are so many countries in one continent, right? So then Maharashtra, Tamil Nadu, Telangana, Odisha, all states we need to demonstrate something where we find some good champions, state champions, government champions there, and we work closely with them. They reform at state level the way how they engage in sanitation. Like they strengthen their capacity within the system strengthening. At the same time, we also understood that how should we work with engage with the local communities, self-help group, women group, so many groups engaged there who became somewhere they became an operator, somewhere they became entrepreneur. So this way, a lot of things happen. You can see all these states are now, if you go there, you will see nice work. My colleague from Odisha, Mahapatra, he is the one of the state government cadre from Odisha. How much he involved, I know very well. And we need to learn from them. Then it's really great opportunity to scale that program entire country in India. This is not happen easily. You know, this is all partners. That's why what I'm telling you from the beginning that it's not money, it's not the thing, partners, people. You can see all this India continent. So how many partners are involved there? I don't 30 or 35 partners, right, Sakshi? So they are part of this program. They created a National Fiscal Service and Sector Management Alliance, and that alliance is becoming so strong alliance who really bring actors, stakeholders, government all together. They are the one who really transform the sector. That's why partners are very much critical. I really congratulate all my colleagues. Can you stand up, my colleagues from India? I really want to say thank you to all my colleagues. Thank you. Similarly, I also like to congratulate my colleague from Bangladesh who really make it happen. Can you stand up? So now I'm going to go to Nepal. Of course, Nepal also was one of the country who actually headed for the lead for the Millennium Development Goal for the sanitation. Wonderful work they did. But again, fiscal service management was very new for them as well. I still remember when we have July, when we had FSM 4 event, I still remember Nepal delegates, Mr. Secretary Bhim Prasad Upadhyay, I remember his name. Bhim Prasad Upadhyay together with several government officials, they came to Nepal, Chennai, to learn FSM 4. That FSM 4 event was transformation for them. And when he went back to Nepal, immediately invited his senior officials that, okay, we must need to go with the FSM program. We need to develop the regulatory system. We need to develop the institutional system. Do it within a month. But I think in the next 3 or 4 months, they really come up with an institutional framework for the fiscal service management in Nepal. And in between, a lot of other things happen. Citywide inclusive sanitation program, all those things are happening. Now the best part of Nepal is they have established regulatory authority in the country. This is because of our Madam Secretary. She is here, Pramila Baldacharya. She is the leader. Actually, if we don't have her, I don't think we can make it. So, and besides that, of course, again, same thing, alliance. CUI alliance established by the colleague. Again, I can't really say all name here, but I can still ask my colleague who were involved in CUI alliance. Can you stand up? So, there are also a couple of colleagues in Nepal was the doer who really made things happen. Congratulations to my colleague from Nepal as well. Now ADB. This is my very interesting story. I don't know if ADB colleagues are here or not. No, you here? No. Jitendra, no. So this is a very interesting story. It was in 2013 when I joined the foundation. My task was 2 tasks. One is to demonstrate fiscal service management program in a couple of cities. Number two is bring the bank to invest more on that. And we have divided our role because in foundation, somebody was responsible for World Bank, somebody was for Islamic Development Bank, somebody was for African Development Bank. I was in charge for ADB. Then I know a couple of people there. I met Amy Leong, who was the that time director. She's now retired already. And a couple of other people I met there. And then we said, how can we work together on this? And they also want to collaborate with us. And then that time, when I saw their baseline data, their investment in non-shared sanitation was only $3.8 million until 2012. $3.8 million for cumulative of a couple of years. And $12 million was for sanitation. Can you imagine? That was the amount in 2013. You can see now graph. Now there is the $3 billion for sanitation, $800 million for non-shared sanitation. So this is transformation happened. And this is the flyer that we bring in the Stockholm World Water Week in 2013. Gunther Langer, maybe you know that time, you were there, no? Where's my colleague here? Somewhere must here. So we were in the Stockholm World Water Week. That time, people were laughing at me. Why you are partnering with the ADB? That time we have created a sanitation trust fund. ADB cannot do, bank cannot do because they are sure people. They only want to lay the pipe. They want to invest big money. And that time people were laughing at me, but now people are thanking to me. So this is not only ADB. This is happening in several other banks as well. So we should be very happy that investment are there. And other big thing is that when we talk about citywide inclusive sanitation, we need a framework. Because still we were, until 2015, we were deep 16 until we were deeply engaged in the fecal salt management. Also looked like the FSTP, fecal salt treatment plant. Everybody were running behind the infrastructure. Then we said that infrastructure is not what we want to see. We want to see the system change. That's why we came with the citywide framework. I don't know if my colleague here, Alice, she is the one who really did hard work to did the framework together with our partner, where our partner from India, especially CIWAS, IHS from Bangladesh, SNB Water, all were involved to develop this. And of course, Athena is another partner who really developed a lot of indicators on the CY. Now, what we said that, what SDG said that outcomes level only, equity, safety, sustainability, that is the SDG goal. But what we are advocating that function, because without having strong function like the responsibility, who is authority, who is accountability body, regulatory body, and where the money comes and how we manage that. Without that function in place, we cannot achieve the outcome. That's why our goal is to strengthen the function so that we can achieve outcome. Of course, we have different tools we have developed. We have EquiServe developed by Athena. We have IIMS developed by our colleague from Nepal and Bangladesh colleague. Now Global Water Sanitation Center is supporting to expand that. And digital governance on the big issue under the CY framework, and which is also happening very well. Especially I like to thank CIWAS, Safety University. I'm glad that Meera Mehta got the award. This is because she is the one who really did that together with, of course, the colleague, but she is leading that. Because of that, a lot of digital governance happening. There are those things also happening in Bangladesh and Nepal and so on. And yesterday, I listened regulatory keynote from Ivan, from SOS. They are doing fantastic job. Now what we did that now we need to bring this learning from Africa to Asia. Then they are the one who is the resource person to run this program, and they have done a lot of capacity building program on that. Nepal is now have already established learning from SOS. Bangladesh is moving forward. India and a couple of states we are doing that work. And the other big thing is sanitation workers issue. Because we talk about safety issue, even the CY framework, but the safety issue doesn't mean that only your like toilet need to be clean. The way you work in that field, sanitation workers need to be taken care of. The way how our partner UMC did that in the Odisha, that was the example. They started from Garima program. The Garima program now taken up by the government and they call Namaste program. Namaste is, Namaste, right? But the Namaste means National Action for Mechanical Sanitation Ecosystem. That program is expanded entire country, that they are really taking care very well for the sanitation worker, and that learning is also adapted. Bangladesh is also doing that very good work on sanitation workers. In Nepal, ADB is also doing supporting on that. And at the same time now, what we thought that a lot of learning is happening in the ground. Now, how this learning to be integrated into the course? When I joined the foundation, or even when I did my PhD or master's, I hardly can read or see the non-sewer sanitation component in the curriculum, academic curriculum. Then our idea is now how to integrate all learnings and design new courses. Damir, Professor Damir is my colleague. I work with him. Can you stand up? Or you don't? So this is the man actually. I work with him since 2012, 13, and we work a lot on this development of the program. Initially started only from IHE Delft. Now it is expanded. The program entire globally, I would say they have now 5 different regions or six regional hubs established, and I'm sure now I always call that we have 6 Damir. Otherwise we have only 1 Damir. We have 6 Damir in this sector. They are promoting all this learning. This is one of the big achievements that what we are doing. And at the same time, Global Water Science Center was established at AIT. That AIT is the one who is putting all the knowledge and giving support to the development bank or government to really integrate what our partners learn. I missed out that, I will show you that slide I missed, yeah. And other one thing, Malaysia. Malaysia is another good example, very Dorai. I would like to really thank Dorai. Where Dorai here? Dorai, can you stand up? I must respect him, recognize him. Dorai is the one who help us to bring the sanitation knowledge from the Malaysia to the South Asia. Without him, we cannot see Odisha. Because Dorai is the one who helped to transform or to change the mindset of the government, especially Mati who got the award also, right? Last time, Mati Bhattan his mindset was totally transformed because of Dorai. So he did everywhere, when we bring him, he's the one who helped us to change the mindset. And then at the same time now, the good thing is we also run a lot of capacity building program. One of the unique capacity building program we call like the Sani Tour. I don't know how many people you know about that sanitation tour in India. So this is like pilgrim visit in India. So many people from the Nepal, Bangladesh, even within India, they visited so many sites where there are big best practices going on. That really helping my colleague, Professor Chari was involved a lot on this, administrative staff college, they were involved. At the same time now, the good thing is we have established, our partners have established at least 10 cities in Bangladesh as a mentor city. Nepal has 5 cities. India has maybe 40-50 cities. They are now example cities where you can go and learn. That's why we call mentoring the mentor, right? So this is something capacity building program that I'll talk about. We have the big capacity building platform in Bangladesh, in India. Like IWA is leading in India. Bangladesh is leading by IWA, IWA. Nepal is leading by the N4 together with the Department of Water Supply, Sewer. So we have very good structured capacity building platform. This is what I made mistake. Last slide was actually mix up with GWSC and the GSGS. GSGS is the one. GWSC Professor Sangam, can you stand up? So Professor Sangam and Professor Damir, Professor Tamara, these two are the leading the earlier platform. GWSC, and this is leading by Professor. So this is example how we are integrating now all learning into the academic world. This is also one example never ever happened in this sector, right? And the other big thing is about the public official city mayors. City mayors are the one who can do the lot of things. Number one, they can change their city transformation. Other hand, they are the one who have direct access to the all political leader. We mobilize a lot of city mayors through the municipal association, especially in Bangladesh and Nepal. This is going very well. And we have one partner called UCLG based in Indonesia. They really bring this knowledge to other cities in the Asia as well. This is the way how they are helping us to transform the sector. And lastly, this one is a very critical one because the country, we don't have the place where there is no regulatory system, we need civil society. The civil society is the one who is leading by FANSA. Here, the FANSA members are here, Lajnaji and Kali can stand up. So they are the one who actually helping to bring the voices of civil society on the ground and helping us a lot to bring civil society voice, especially urban poor from the community. I'm done. Only last slide. Otherwise, Dulai will kill me. This is that now. One ticket done. I'm going out. Next ticket coming. Dulai, Sakshi, Carl, my colleague are running behind this technology. I'm quite hopeful it will happen. It definitely happen. After it happens, who is going to promote that? This, right? These are the people. Dulai, don't forget them. Many of them are here maybe. This is the best picture I would say. We did one big meeting in Kathmandu and where many colleagues came here and discussed, and they are our seat mafia in the world.
Shit mafia.
Thank you.